Hi, I'm Dr. Judy Monroe, President and CEO of the CDC Foundation, and I'm very pleased to join CDC Director Dr. Rochelle Walensky today to discuss meeting tomorrow's public health challenges. Now, speaking of challenges, Dr. Walensky and I are able to be on stage together in person because we both are fully vaccinated, and vaccination is the road forward for our society to get back to normal. Dr. Walensky knows the challenges and the heartache of the COVID-19 pandemic more than most. She was on the front lines working with individuals and healthcare workers and communities prior to coming to CDC. Rochelle, thank you for joining the conversation. It's so great to join you today.
I'm so delighted to be here with you, Judy.
So let me kick off with a question for you. COVID has obviously revealed and exposed some real challenges for the public health system. Do we need to be thinking about public health differently as a society?
You know, I think people didn't even know what public health was. The work of public health happens when it's quiet and these things don't rise to the media. They don't rise to people, the general population. And what I think has happened with this COVID-19 pandemic is that people really recognize the work of public health and the critical importance of what public health is doing. I do think we have to envision a new future for public health. Among the things that I think we've learned in the last year is how important it is to convey the science, to lead with the science, to make sure that we articulate that science and we communicate it to the public and articulate why it is that we're making policy decisions. So I think the science has to lead. We have to communicate that. I think we do have to work on our public health infrastructure. That has been frail and thin for years. And we really have to think about how we're going to build the workforce, how we're really going to build our lab systems, our data systems for the next, decades to come. I think we have to invest in health equity. I think that has just been really clear through this pandemic. Those of us in infectious disease and population health and public health have known this for every disease previously to COVID-19, but that has really shined a light on what we need to do in health equity in the future.
Yeah. So you're leading CDC now, a phenomenal agency with a long history. How do you see the agency needing to evolve given these new challenges?
First of all, it's just been a true honor to be here. It's been extraordinary to meet the people who are working 24/7, really. And I can say the logo says 24/7, and it's truly been true over the last 10 weeks as I've been here. A request, a need, anything, any time of day. People are here working for the nation's public health. We are invested in equity. We need to make sure that not only are we working towards vaccination equity, testing equity, following the cases and understanding where they are and why some communities have been harder hit. But we need to make sure, as we're doing all of that hard work now, that we actually make those investments sort of stick for longer than just COVID-19. So can we make sure that the investments that we're making with our community-based organizations and our faith-based organizations, can we ensure that they stick so that we can go back and work on hypertension or on childhood vaccinations or cancer screening in the future? We need to work on our data monetization. We need to make sure that our systems are talking to one another, that we're not using fax machines to bring in test data and then going to our health systems and trying to get data from them. We really need to monetize our entire data systems, and then we need to integrate them. We need to make sure that our systems are talking to one another. I don't think there's another nation in the country where our public health and our medical systems and our healthcare systems are so unintegrated. And so really we need to have them talking more fluidly to one another. Now we have such extraordinary healthcare record systems, and we really need to have them being able to talk to our public health systems.
Yeah, really important points. A lot of work to do.
A lot of work to do.
So it's going to take all of us, right?
Indeed.
So speaking of that, what do you see the role of the philanthropy and the private sector working with government to take on really this new world and these new challenges?
I think it's absolutely essential. If we have learned one thing in this pandemic, it is that Public health is not going to do this alone. Healthcare systems are not going to do this alone. The government can't do this alone. We are going to need partnerships across all agencies. We're going to need public-private partnerships. We're going to need innovation and public health. And I think across all different disciplines, one of the silver linings has really been to see how these disciplines have been able to work together, how we've learned from one another, leveraged each other's expertise. And I think that is going to have to be the future of public health. These partnerships through CDC Foundation, we are so very grateful, are going to be essential in our future. And linking the public-private partnerships, academic partnerships, I think is going to have to be part of this next chapter.
Well, I will tell you, the pandemic has brought more partnerships and more attention to the foundation and to CDC, certainly. Thank you for your leadership. And I have to tell you, I just love your energy and your positive approach. So thank you. And it's been wonderful talking with you.
Thank you so much, Judy.